Hi everyone, welcome back. So today I am going to be doing a post aimed really at you male bodybuilders out there, and I'm going to be talking about something called pectoral gap, or it may be called pectoral separation. Now, if you have you might have seen my video, although it was aimed at postnatal women. It does also happen to men, and certainly, again, male bodybuilders are particularly at risk of this. So that was the video on abdominal diastasis, or abdominal separation, or diastasis recti, which is basically where, in men, is where those six-pack muscles become separated, and you'll see there'll be like a noticeable gap. So today I'm talking about pectoral separation, which basically has the same effect. So it means, when you're working out your chest and you can see that separation of the muscle just there. Okay, and when you get this, quite often it seems like it doesn't matter what you do, that separation is still there. So that's what we're going to be talking about today. Now, there are various causes for this issue. Now, sometimes it can just be impatience, and having maybe a poor or inconsistent workout plan. And this is often the main cause. And sometimes, people get so kind of excited that they're starting this new workout, and then they might overdo it, or they might, just really push too hard. But make mistakes in the process, and then you don't quite get the effects that you were looking for. But certainly there are other causes for this. So traumatic injury, anything where there has been detachment of the pectoral muscle. So this may be through previous injury, or sort of gym related injury, or it could be some other kind of physical trauma, through an accident or whatever. Unusual growth patterns. So this, we're talking, if you're taking growth hormone, that can actually cause sort of slightly abnormal growth patterns, and that can then cause separation of the muscle. Also steroid use. Muscle tears are actually quite common with steroid use, because the muscles are developing much faster than the tendons, and so what this does is it then increases the risk of tears. Not to mention all the other issues associated with taking steroids, so best avoided. Pec implants. Now, this may not be particularly common, but yeah, if you have pec implants, obviously that can potentially then strain certain areas of the muscle, and you can end up with separation. As with a lot of these things, genetics, is quite often involved. And this is, when I say this, I mean in terms of where the pecs attach to the sternum, which is your breastbone. That will be kind of genetically determined. And, in some cases, there may be some sort of asymmetry. So one side may be, the pec muscle doesn't develop, as well as the other side. And again, this tends to be a genetic thing. You know, and in some cases, this pec separation, there's not really a known cause for it. It's just one of those things that happens. So the question is, how can you treat this? How can you, you know, fix it? Well, there's not really a definite fix to this, you know, but there are ways that you can sort of make it less noticeable. So I think the most important thing to say in terms of treatment is, you know, patience. You know, large pecs take years. As I'm sure any bodybuilder will tell you, you know, it takes years of hard work, not just a few months. And as the pecs increase in size, the gap will appear less noticeable. It'll still be there, but it will seem less noticeable because the focus, you know, will be kind of drawn to the actual pec muscle itself rather than the separation in the middle. You know, patience and be consistent in your workouts. You know, don't sort of just suddenly sort of overload the chest muscles. That's not going to work, and it'll probably just, you know, mean that your back muscles will then start to overcompensate, and you see these bodybuilders and people who basically go to the gym and, you know, their big focus is getting big pecs, and so they work out their chest and then they end up kind of hunched. Their back muscles weaken because they're not putting the same focus on their back muscles, and then they're getting problems and they're at high risk of injury. So just be consistent and be patient. Use a well-balanced workout plan which will work the chest from all angles, so neutral, incline and decline, and by doing this, you know, you'll be able to build muscle mass in the inner, mid and outer pecs. And to do that, which I will talk about, you know, because of the attachment points of the muscles, you know, it's going to involve different exercises. It's not just like, if I do like a, you know, bench press, that will work my chest. You've got to, you know, you've got to kind of have a balanced workout. If you're going to modify your workout, don't do it just by adding sets, because all that's going to do is sort of overuse of the muscle, which then puts you at increased risk of injury. And also, by doing that, it can also actually halt the growth of the muscle. So how do we actually work every part of the chest muscle? So how do we sort of work in particular that inner you know, part of the pec muscle? So while you can do exercises that work both the upper and lower pecs, the same doesn't apply to the inner and outer pecs. And again, as I've said, this is because of the attachment points of the muscle. So, right, so for the upper pec, you can see this diagram here. So we're looking here. So for the upper pecs, the pec muscles attach to the upper arm here and the collarbone across the top here. Okay, so it's going just across here. That's the upper pec. Now the lower pec, you can see here, again, attaches to the upper arm, but instead of the collarbone, it's attaching to the sternum or the breastbone. So the lower pec is much more widespread, whereas the upper pec is quite you know, quite a smaller area in comparison. So, okay, so I'm going to sort of discuss what exercises will work for each section. So for the upper pecs, which are the ones that attach from the top of the arm to the collarbone, coming across here, you can use the following incline exercises. But because it's just working this area here, it's not going to do anything for the inner muscle where you've got that separation. So for this upper part of the pec, you can do incline dumbbell press, incline fly, incline barbell press, military press, dumbbell shoulder press, low cables, push-ups with raised feet. All of these exercises are going to work that upper pec. Now, the mid and the lower pecs, which are attaching on the breastbone here, they're the more widespread ones. That's where the inner pec, where you've got that separation, lies. And so these are going to be developed by exercises that are at a neutral or decline. So for the mid pec, you are going to be looking at things like a flat dumbbell fly, a flat bench press, flat dumbbell press, push-ups, mid-height cables. That will do the mid pec. But for the lower pec, sort of coming down here, you're looking at exercises like your decline press, decline flies, high cables. Now, while these exercises, they don't specifically target the inner pec, they will help develop it alongside the middle and outer pec. By crossing the midline during strengthening exercises, the centre line of the chest will be more well defined, and muscle separation, although it will still be there, it will appear less noticeable. But you know, if this is done following exercises that target the whole chest, you know, then the inner pec muscle will have to work harder to combat muscle fatigue. So, for example, with cable crossovers or cross-body cable presses. So you're going to be working then that inner pec a little bit harder, and so could potentially, you know, help develop it a little more. But again, you know, the separation will still be there. Now, obviously, part of my job is massage. Now, while massage, I do massage of the pectoralis muscle. Quite often, you know, if people come in with shoulder issues, you know, sometimes that can be because the pectoralis muscle is tight. So by releasing that muscle, you actually take the tension off the shoulder. But while massage won't directly assist with pectoral separation, it will help to strengthen the muscle and improve the posture. So from that point of view, you know, massage of the pectoralis muscle combined with these exercises, you know, for each specific part of the, you know, the pectoral muscles, it can sort of then have a knock-on effect. As I say, it's not going to be some miracle cure. The separation will still be there, but it will hopefully just build the rest of the pectoral muscle, and the muscle growth that comes with that will just take the focus off that separation. So hopefully that has been of some help. But I am not a personal trainer. So the information that I've shared today is based on my knowledge as a sports therapist, anatomy and physiology, and my knowledge sort of from the clients that I get in. So certainly, if you do have issues with pectoral separation, do consult with a personal trainer as well, who will probably be able to come up with a good balanced workout for you that works each part of the muscle. But feel free to comment down below or contact me through Facebook or Instagram. And if I can't answer your question, I know a couple of excellent personal trainers, so I'm sure I can find an answer for you. Subscribe to my channel. There'll be more videos coming out on specific muscle groups, specific injuries, and how you can sort of treat them. For now, as far as pectoral separation goes, that is it from me. So I will see you next time. Okay, bye.